The Affordable Care Act takes effect next month. The latest NBC Wall Street Journal poll shows Americans oppose it, believing it will produce damaging results. 52% believe the law will raise their health care costs. Is everybody wrong?
Yes, they are. I mean, let's look at the facts. Already the Affordable Care Act is providing health insurance to young people who didn't have it before because they can stay on their parents' plan. Already seniors are getting billions of dollars in discounts on their prescription drugs. Already there are no lifetime limits if you already have health insurance, so you don't find yourself without care because of some fine print. Already insurance companies are rebating money back to folks because the law requires insurance companies to make sure that they spend the money on health care.
Some rates are rising in some places.
Well, look, what we've seen is that the lowest increase in health care costs in 50 years. Over the last several years. So there is no evidence at all that this is somehow making healthcare more expensive. There is a lot of evidence that it's helping to make it cheaper. And on October 1st, everybody who's watching who does not have health insurance is going to be able to go on healthcare.gov and take a look at the plans that are now going to be available. Cheap, high quality health care that you can't, that insurance companies will not be able to prevent you from getting because in fact, even if you have a pre-existing condition, you're going to be eligible and you'll get tax credits to help you pay for it. And I think this is especially important for Latino community to understand because nobody is more likely to have health insurance than Latinos in this country, and they stand to, for the first time, get affordable health care coverage that they can count on for themselves and their families. And they don't have to take my word for it. They'll be able to go to a website or place a phone call, and they'll be able to look at the plans, how much they cost, the deal that they get for it, and choose one that's right for them. And I think what people will find is, in fact, that it's an absolute good deal, and they should take advantage of it. And when you look at some states like California who are really moving this forward, they've already started to estimate what their premiums are going to be. People are potentially going to be able to get health insurance for less than their cell phone bill. They'll have that security and that coverage. There are other states like Texas where the governor has been resistant to fully implementing it. We're still going to be working with mayors and local community organizations to sign people up. We're optimistic that you're going to see over the course of 6 months, because there will be an open enrollment period for, from October 1st all the way until March. What you're going to see is people seeing for themselves how they can benefit and have the kind of security for healthcare. And by the way, the kind of healthcare plans that are going to be in these marketplaces that they can choose from, all of them are going to provide preventive care. So if you're a young woman, for example, let's say a young mom, under these insurance plans, contraception is free, regular checkups are free. The cost of the health care monthly will probably pay for itself compared to the out-of-pocket costs that you're already spending. So it's going to be a good deal, and we expect that once it's fully implemented, a year from now, 2 years from now, 5 years from now, people will look back and they'll be asking, what was the argument about? Why is everybody fighting this so much?